My dog is such an old soul. He hates noise or when I'm talking too much. And now he's leaving the room because he likes peace and quiet. Can you blame him though? Not really. Hi guys, it's Tani and welcome back to my channel. I know in my last video, which was a vlog, I had mentioned to you all that I had just finished a 4-week placement, which was my second placement during my course. I did do a debrief on what my first placement was like, but I was wondering if you guys wanted a debrief on my second placement, and I had a lot of messages saying that you would really like this. I want to make it a little bit different to my first video. I'm not going to walk through what happened every single day, maybe just what my experience was like, just because I find it really useful listening to other people that are in my position going on placements, and just kind of what experience they're getting and maybe what to expect on a future placement that you might come across. So yeah, I'm just going to do a quick little deep dive on the placement that I had. Keep in mind, because it has been so long in between videos, that placement was actually in, it must have been August. Yeah, it was August of 2021. We are now in January 2022, so it has been a fair few months since that placement. What I want to start by saying is not every placement is the same, which seems obvious, but I think it's good to remember that every hospital is really different and every ward is really different. So what I say today may be a completely different experience for you. Perhaps the ward that I'm on maybe comes across as really a lot more educational and a lot more helpful. Again, you might have even better experiences than what I have and get to do a lot more because you are on a ward where the nurses are really keen to teach and educate you. So I think it really is going to differ from hospital to hospital because you just never know what nurse you're going to be placed with. The number one thing I would like anyone to take away from this video is just to be prepared for anything, because no one's experience is going to be the same. I know a lot of my classmates seem to be able to learn a lot more than I was on this placement, and that purely just comes down to their nurses having a little bit more time to be able to walk them through skills. Also, one thing I would probably point out too is it's really hard because when you're a nurse, you're a nurse, you're not doing a teaching degree. So it can be a little bit frustrating sometimes when you're put with a nurse who perhaps isn't that natural kind of teacher or natural leader who works well with a student. That's the one thing that I think is the most overwhelming when you're at placement is these nurses aren't built as teachers. But you have to also remember these nurses aren't built as teachers, and you can't expect it to be like TAFE or uni where your teachers are literally there to do that, teach you. My last placement that I went on was at a local hospital and I was in a stroke rehabilitation ward. I was really intrigued when I heard that I was placed on this ward. I knew nothing about strokes and I'd never had any experience with that kind of work and those type of patients. I've only had 2 placements, but out of the 2, I found this placement the most challenging, mainly because I actually found the ward to be a little bit more slow paced than what I was expecting it to be. And I guess I want to preface too that slow paced doesn't mean it's actually slow paced. It just can be hard as a student to sometimes get involved in some of the tasks that your nurse has to be involved in, and that just comes down to scope of practice. Overall, I had a really positive experience and I did learn a lot, but I did find it to be a very challenging placement. What I find really useful to know is kind of how your first day goes on placement. So with this one, you all meet in a central meeting area. This was the same as my first placement, so I think this is something that maybe everyone can find useful, as it should hopefully apply to any placement people get. So you'd all meet in a central area. Someone comes out the front and basically just dictates how the day is going to go and introduces you to your what are they called? Facilitator, that's the word. That was also another interesting thing. On my first placement, we had facilitators, but they were actually our TAFE teachers, and I only saw my TAFE teachers once it was a 2-week placement, that one. Whereas this placement, we had facilitators that were there every single day. So a facilitator is basically just someone that is hired to come in and kind of just be your go-to person if you need any help. They might come visit you once or twice throughout your shift just to make sure you're going okay. They should also be health trained. So they're people that you can go to for education, for advice surrounding like what to do with patients. So that I found really, really useful. So yeah, we got introduced to our facilitator, and then the facilitator took us up to our designated wards. So they're kind of the person that knows their way around the hospital a little bit. They drop you off at your ward and make sure you're introduced to the nurses there and some of the staff. For this placement, I was placed with one nurse the whole 4 weeks. That can be a good thing or a bad thing. I guess it just depends on what your nurse is like as an educator and as a teacher. I was placed with a really, really nice nurse, and he was really, really easy to talk to. One thing I did find is he wasn't a natural born leader, a natural teacher. And that's probably the thing I found most overwhelming about this placement was I really had to kind of step up and be the person to get myself involved in patient treatment, I guess. Again, that's nothing. I don't think we can complain about that as students. You can't expect to be put with a nurse who is able to show you everything. They have things to do. They have their own stresses that they have with their own patients. And I think I found myself getting caught up in that a little bit and being a little bit disappointed that I wasn't, I guess, as hands-on as I was hoping. But once I got into the right mindset, I kind of just went, do you know what? I've got to learn as much as I can, even though I feel like this is not what I expected. What I started to do was just fake it. I always say fake it till you make it. I was just going, I'm a very shy and anxious person, but I went, do you know what? I just have to be confident. I have to ask. I have to say, can I come and do this? Can I come and watch you do this? I also ended up going to a lot of the other nurses on the ward, seeing if they needed help, if there was anything that I could do for them, anything I could observe. And I think it was just a little bit of confidence that made the nurses kind of happier to have me involved in the care for their patients, I guess. I think my advice to anyone is if you feel like you're in a situation where you're not learning much, you are the person that has to turn that around, unfortunately. You can't rely on anyone in the hospital to do that because they're all there just doing their jobs. So yeah, just try and involve yourself as much as possible. One thing that I have done on both my placements really is when I've got nothing I'm really doing, I just respond to any of the call bells. So normally you'll be placed with a nurse and then you'll be allocated your patient beds. So the ward I was on was quite good with their staff allocations, and I don't think we ever had more than 4 patients at once, which I think is quite rare and really good. So yeah, we were allocated 4 patients, and they're kind of the people that you just look after for the whole shift. So I would, of course, prioritize them. They were my patients. However, I would also, if I wasn't doing anything and someone else's call bell went off, I would go and answer anyone's call bells just because I thought, you know what, I need any learning experiences I can get. Just for example, a few of the things I did was I would just help with showering patients. I would just help with, what do you call it? Like even making beds, changing patients. I got to observe a gastrostomy bag change, even setting up Zoom calls. That was also another thing. So when I was on placement, it was in the height of Sydney's lockdown, and I was working in one of the hospitals which was in a hotspot for COVID. And all of this meant that there were no visitors allowed in the hospital. So it was a very confronting experience. Maybe not confronting, it was just a really sad experience because, I mean, especially in stroke rehabilitation, You have a lot of patients who can't move, can't talk, can't feed themselves. And I think a really important part of the rehab process is having support from family, friends, and loved ones. I think that was another thing that I really learned on this patient is how big a role you do have as a nurse, especially when COVID hits and you've got those times where you can't have that family support for your patient. So you kind of have to really become an integral part of the healing process. So that was both confronting, but it was really special to be a part of that. I might have mentioned this in my last placement debrief as well, but what to bring, I would just say, obviously wear your uniform. I wore a fob watch just because some people in my class didn't wear them. And there are clocks in the hospitals, but I just find it something really useful to have on you just in case. So I had my fob watch. I always had a notebook and pen in my pocket just in case I needed to write anything down. To be honest, that's really it. I think the only other things I bought was like my lunch. That's really it. You don't need to bring anything. Like, I remember my first placement, I was like, do I bring my stethoscope? No, you don't bring anything. Hospital has all that. You don't need to bring anything of your own except for maybe fob watch and a notebook and pen. So yeah, that is really it. If you do have any more questions about that placement and about that experience, please just leave comments down below and I will try to get back to you as soon as possible. If you have enjoyed this video, I would really like it if you gave it a thumbs up and also subscribe to my channel, as it really supports me and allows my channel to grow and help other people. Anyway, I'm going to stop blabbering. I will see you guys in my next video. Bye.